and welcome to another episode of the podcast, formerly known as Three Plastic Surgeons and a Microphone, but now rebranded as Three Plastic Surgeons and a Fourth. As always, I am Sam Jejurikar in Dallas, Texas. I've got Sam Rhee from Paramus, New Jersey, who's at Bergen Cosmetic. Dr. Lawrence Tong from Toronto, Canada, who's at Yorkville Plastic Surgery. And Dr. Salvatore Pacella, who is at San Diego Plastic Surgeon and practices in La Jolla, California. How are you guys today?
Excellent.
Great. Good to see you guys.
We should call this the Rhee mix, RHEE-MIX. Four plastic surgeons remix.
Ooh, I like that. I like that.
All right,
So,
Dad.
I mean, I liked it, but I thought it was good. Keep trying. Sometimes you strike out, but you always got to put in the effort.
Hey,
So-
you
Right.
miss 100% of the shots you don't take.
That's exactly right. Or you don't make 100% of the shots you don't take. You actually don't miss them. But
True.
so we've got a little bit of a different topic today, and I think it's sort of spurred by what's been in the news and driving the stock market and just sort of all over the place these days, and that's artificial intelligence. I think it's going to be a really interesting discussion talking about applications of artificial intelligence in plastic surgery and in medicine at large. Before we get into the meat of our conversation, though, does someone want to read our usual disclaimer?
Absolutely. This show is not a substitute for professional medical advice, diagnosis, or treatment. Shows for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment after appropriate discussion. Always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care, and never disregard professional medical advice or delay seeking advice because of something in this show.
So I think what kind of got my interest and Pacella's interest really sort of jump-started in this topic in the last couple of weeks is sort of all of the conversations that have been happening about this company, NVIDIA, that's out there. And this last week, NVIDIA had their big tech conference in San Francisco where they started talking about applications of their future chips. And there were some really cool ideas. One of the things that was really kind of big, not in plastic surgery, but in medicine, was the company Medtronic, where they were talking about standard colonoscopies that people have, and the rate of doctors missing lesions is somewhere between like 20 and 30%. And now with some newer technology using using imaging, they're going to be able to use AI in this to come up with a test that's going to be far more accurate than what we currently have. And so that got all of us sort of digging into, well, what are the applications of AI in plastic surgery? And there are actually applications that are already starting to happen. So before we sort of get into examples that are out there, are there ways that you guys are using even now AI in your interactions with patients, in surgical planning, in surgery at all? Or is this just something that's still way off in the future in your mind?
So I have found AI very, very helpful in saving a tremendous amount of time when it comes to insurance authorization or denials or pre-authorizations, etc. So, for those of you out there that know a little bit or don't know anything about the insurance process for approval, when we evaluate a patient, we have to do a formal evaluation. We have to put these series of diagnosis codes with what are called CPT codes for each procedure. And we submit these to the insurance company, and our hope is that they would approve those codes. Sometimes they deny several codes for unclear reasons. And, many times we have to appeal to the insurance company to accept a code. So for example, let's say I have a lady with breast cancer years ago and then has some complication related to that cancer. Well, sometimes the insurance company balks at doing a revision because they say, well, your cancer was years ago, but there's actually federal law that protects women for this particular reason. And so years ago, I used to spend an exceptional amount of time typing a long letter to the insurance company, reminding them to do this and that and the other thing, and it would be marginally successful. And now what I do is I include so I don't put any patient information, check GPT, and I said, give me a letter that's stern but firm, but respectful for a patient who got denied breast cancer reconstruction. Please reference the Women's Health Right Act of 1987, which protects her right to have breast reconstruction. and it spits out an amazingly structured letter that we can just send off and sign. It saves an exceptional amount of time. The other place I use it is sometimes is in operative notes. If I have a relatively routine operation, I may kind of use that as a template and then edit my template from there. I'll oftentimes use it in patient correspondence to send patients letters. Here is the result of your biopsy, or this or that or the other thing. So I've used it mostly for correspondence. It's also great for poems too.
And you are so good at that.
Yeah, and I think what Pacella is sort of is illustrating is how artificial intelligence in medicine in general can allow us to take tasks that would take X number of minutes to do, and it cuts it down by a factor of 20 or 50, and allows us to do a lot more of the menial aspects of medicine in a much more efficient manner. I use AI a lot for all of my notes. For instance, I dictate my notes, and just like Pacella, I leave out all identifying patient information, but instead of dictating my notes into my electronic medical record, I'll dictate it into ChatGPT-4 and it'll just tell it to proofread it, and I'll put it into a bulleted fashion, and it'll generate a note that then I can easily import into my electronic medical record. And it makes the documentation better than it ever was before. And the length of time it takes for me to do it has gone down by a factor of 10. What's interesting though, what really got my interest is what we're sort of talking about too, is I think are ways where in all industries, we're really, kind of plastic surgery sort of following along what other industries are doing, where for documentation purposes, we can generate notes or we can write letters. What about surgical planning? Can you guys see any sort of role for AI in terms of how it might impact your consultations with patients, or how you might be able to get patients to envision what their surgery might look like?
Absolutely. Go ahead, Larry.
So I was just thinking about this topic, and I'm pretty sure nothing's out there yet, but when we do facial rejuvenation, facelifts, blepharoplasties, whatever, patients will often come in and they go, well, I want to look like how I used to look like when I was younger. So, could there be an application in the future where, a patient can bring in their old photographs and you upload their current photographs, and then the AI will say, okay, well, in order to get as close as this as possible, you should do a brow lift, the blepharoplasty, you should put the fat graft in this spot or this spot. And I think that would be, very cool, but also very helpful. Most of us, I'm sure, could do it on our own, but it could be a big time saver or just confirm, your surgical plan. So, something like that could come along. I think that would be pretty cool.
I think, and I was talking to someone, we're not that far off in terms of AI helping us with surgical planning. And I could certainly see many surgeons use 3D imaging and scanning of faces and bodies. And it wouldn't take much to be able to say, okay, what if this patient only had liposuction done for their abdomen? Demonstrate what that might look like. How about a tummy tuck plus this? How about fat grafting plus the tummy tuck plus this? How would what would a face look if you just did 1 cc of filler, 4 cc's of filler plus a rhinoplasty, chin augmentation? You could throw about 15 different scenarios, and you could say, how close does this look to an ideal proportion in terms of what and general population standards are in terms of waist, bust size, hips, like how far off the standard deviation is this? And patients could get a ton of information in regards to, and I don't know, this cuts both ways. I could see it being helpful and also hurtful in terms of them saying this is where you deviate from what normal population standards are, or what an ideal aesthetic standard might be, and these are the different procedures that might help you achieve it. That's pretty powerful if you think about it, if you could just show that to a patient, because right now we're already showing patients lots of simulated surgery, but now you could show even more combinations of that and reference, say, other people. Maybe you have other reference models that you wanted. What do I look like compared to Angelina Jolie? Like, you can have an AI say, you look the most like this famous person, and this is what you would need in order to sort of mimic that.
To some degree, that is already starting to happen, guys. And, I think I've mentioned in previous podcasts that we do a lot of 3D imaging, particularly for breast surgery and nose surgery in our office. And the particular company that I use about 3 years ago started using an AI model for those 3D images. So just to take a step back, AI implies that you have this repository of knowledge that's sort of drawn out from all this knowledge that's out there. And then there's a component of machine learning that's happening as well, where there's a neural network. And then based off of all the models that are happening, as you get a larger and larger sample size, the quality of information that gets spit out by the model gets better and better. And that's what's happening with what I'm using is Chrysalix. And in fact, they just sort of in the last month unloaded their most recent AI breast imaging models. And the quality of these images that come out literally just from 3 images from an iPad when you're doing it with breast in one measurement is ridiculous how much it looks like that. For rhinoplasty, it's actually becoming very good now, where you're even seeing intranasal anatomy that you can't really see that well with the iPad, but based off of these images, it's actually beginning to. So it's happening. It's already starting to happen. But what you said is it does cut both ways, Sam. It really does. And in some ways, when you create this model that looks so realistic for patients and you're able to do things on it, the post-operative result doesn't look like that. And the model, you do wonder, could this actually be setting up, like the pre-operative modeling aspect of it is very accurate. We don't do post-surgical scans on these patients to know whether or not the simulations are any good. So could it be setting up false expectations for patients?
Yeah, that is one of the biggest problems I always have is if you show them these pictures and they hang on to them and they're like looking at themselves afterwards and they say, this is not what you promised me. And we've talked about this before about guarantees, promises, expectations. Like you said, the realism now and the fact that this is based on larger models, they could say, listen, Chrysalix is now saying this is the way it should look exactly the way it should look when you put in 350cc implants. And this is not the way I look. Could be a problem.
All right. I want to pose a general question to you guys about surgery in general, but not necessarily plastic surgery. Can you envision a world in which a robot would perform a laparoscopic cholecystectomy with limited or no human interaction of any kind?
It could do it in
future. It'll happen. Of course.
It could do it in steps. So what you would have to do is, and this is sort of what they do already for, say, the Mako robot or guided like orthosurgery, is you look at the image and you pick out like, here's the gallbladder, here's the cystic artery, here's the common duct, here's the cystic duct, and you like tag all these things in the image, and then the computer would be like, okay, now ligate the cystic duct. And it goes in and it does that step for you. Done. And then you're like, okay, now like start to peel the gallbladder off the liver. And then it starts to do that for you. And then you're like, stop. Okay, go like 10 degrees more like in this direction. And then it'll start doing that. You're like, stop. Okay, like keep going here. So I could see it, maybe not like from start to finish, but I could see it sort of doing multiple steps as you're guiding AI and telling it like the landmarks and what to identify and what to do, for sure.
I mean, I think it can absolutely go from start to finish. I mean, to me, don't you think that the AI can learn after looking at millions of CT scans where the variations in every single person's anatomy could possibly be, and then figure out exactly where the gallbladder is?
I mean, it's like self-driving cars, sort of, but like there are going to be some catastrophic mistakes.
Right. There's some checks and balances that you have to oversee for sure, but I think it could plug and play. I mean, they already do manicures completely with AI. You put your hand in, boom, done. You know?
That's a little different.
How is it different?
Actually, how is that different? How is that different?
It's a step process, right? I mean, it's not invasive, but it's
You're not
superficial.
cutting
So
anything.
Right. So
you're cutting nails. Yeah, you're
so
cutting
I-
you're cutting the little cuticles out. They're doing all that.
Yeah,
I mean-
you're right. I saw some video where they were like putting on these the eyelash extensions with this robot,
Yeah,
and I thought that was freaking cool. So, yeah, I think it'll happen for sure. Right now, it's probably in a sort of idealized situation that it can do it, but as progress continues,
it's not that far away, guys, I think. And, what Sam was talking about, the stepwise manner for doing it, is just because until we have full proof of concept that we've had 100,000 cases where a robot has done this and not killed anyone, you need to have human oversight of the process to make sure of it, to make sure there's supervision of the neural network. But once that's over, once you get past that, there's no reason why it couldn't go from beginning to end, which then leads me to this segue. What's the role of AI machine learning in plastic surgery? Because that feels different to us as plastic surgeons, where there is an art to it as much as there's the science or taking things out. What can you see robots doing in plastic surgery?
I definitely foresee the quote plastic surgery closure being obsoleted by robots. So if you take, we already have certain like subcutaneous staplers and like not good things, but there's no doubt if you could run a robot to do skin closures, there's no doubt that you can identify like how it works, or maybe even something more complex like microsurgical anastomoses. But I would say even skin closures, you line up the robot, you tell it like where to go from here to here on your tummy tuck, and it does the subcuticular stitch for you and it closes it up. And I can guarantee you, in our lifetime, before we're dead, hopefully, we will see the ER like saying, "Oh, we got a big laceration here. Bring in the
The
Doctor,
suture monkey.
yeah, Dr. J, the surgical robot," and they wheel in the robot and it goes and it does a really nice plastics closure for you, and boom, little Jimmy is out the door without a problem or whatever it is. So I could see that for sure. Like I could see that being a big thing.
That doesn't seem like that big of a leap. Like, could you see a robot doing an operation in much the manner we were envisioning for a gallbladder? Could a AI machine learning device do a breast augmentation and have the aesthetic judgment that, right now we'll see a patient that's going to go to 10 of us, right? And is going to pick the surgeon that think most matches their aesthetic ideals, and they'll pick us to do an operation that we think is a relatively easy operation. Where does the art aspect of, the comfort for patients come in versus the scientific aspect of a closure?
I would argue that the art of it is irrelevant. It's all what the patient wants, right? So I could easily see a situation where a patient comes in, they get a 50 image test for the patient's aesthetic ideal, saying, choose these 3 breast augmentations from side to look, and there's sort of a qualifier of aesthetics the patient sort of hones down to, of what they want to look like. And then that's the model that the robot does for the breast augmentation. And it's, son, we're out of a job.
Well,
I
it
think
won't be in our lifetime. It won't be in our lifetime.
I think it'll
Do you
be in
think-
our lifetime. I think it'll be in our lifetime. I don't know if it'll be during our career.
Do you think a surgical robot would be good enough to be able to make that incision, do the dissection, make the pocket the way a skilled person could do now? Like that takes a little bit of more judgment than, say, just like a gallbladder, in my opinion. Honestly, even something simple like a breast aug.
We're not there yet, but a few weekends ago when my self-driving Tesla took me all the way from Dallas to Austin, and literally I just kicked back the whole way, and it even stopped me at Buc-ee's to get me, which people outside of the South don't know what Buc-ee's is, but it's the cleanest bathroom rest stop. I even said stop at Buc-ee's on the way, and my car stopped me at Buc-ee's so I could get some beaver nuggets, which was a delicious dessert, by the way. A little
is
bit
that
of a
what they're called?
digression.
That sounds
Yeah.
no,
A little bit of a
that shouldn't sound
digression,
right.
but if a robot already can drive me from my garage to Austin, Texas, with limited human interaction, I do think there will probably be a time that yes, the robot will be able to do it as well as a human.
How many people did you hit along the way?
Just one, but
No, let me ask you this: how did you feel sitting behind the wheel while the car is driving itself? Were you
It's
freaked out?
freaky
or-
at first. No, it's
Yeah,
freaky at
at
first, but then once you get used to it, it's great.
its style is different, right? Like, and this wasn't my first time doing this. This was probably the 10th time I've gone on a road trip with the car doing that. So I've gotten used to it. But yes, its style is different. Like what our impulse might be, like if you're in a blind spot for another car, might be to speed up to get past it. The car might slow down. So its behavior might be a little bit different in a situation than what ours is. But once you realize that the car recognizes there's no blind spot because there's cameras everywhere, so the car knows everything that's happening around there. The car sees the lanes, the car knows how to follow directions. And, I felt pretty relaxed. It's more helpful to me when there's somebody with me, so I have someone to talk to while I'm doing it. If it's just me in the car, I get a little bored.
How many times you fall asleep?
Zero. It'll disable if you do that.
I know.
What I do
So
think
you
is
have
a
the
little
full,
bit.
you have the full
Sorry.
self-driving. You have the full self-driving suite, or which iteration is it?
Yeah, it's the full self-driving suite.
Yes.
But to get back to plastic surgery, did you guys see anything about the NVIDIA Omniverse? Have you seen what this is? It was a big thing last week where they were talking about it specifically with with factory design and car building, and where basically there's a scenario where NVIDIA has designed this design platform where you can kind of create a virtual environment and using something like Vision Pro goggles. I know you got a pair of them already, Dr. Rhee, right? You've got to have a pair of Vision Pro goggles. You don't?
All Asians do.
That stuff.
You said
Any
the
of
Google Glass, Samir?
that
I
stuff
used to have
makes
Google
me.
Glass.
It just gives me horrible motion sickness. I can't have that stuff around. I can't. It doesn't make me feel good.
Well, what NVIDIA was showing at its conference last week was there were people building a factory. They're all wearing Vision Pro goggles from all over the world. And they're in this virtual environment where they're all sort of participating in the design of something. And I could see a situation where surgery is involved, where you can get input from people from all over the world to actually help consult on operations, or that you can train residents in this sort of manner using the Omniverse. And I think AI machine learning is going to become really important for surgical training in the next 5 years. I mean, I can see that happening very quickly.
Yeah. You know what? Let's see how it does with the porn stuff first, because that's where all this stuff goes first is porn. And then after that, after they do all the porn stuff, then it might trickle down to surgery eventually. That's
Ooh, nice play on words there. Okay. Anyways, yes.
All right, guys, I'm gonna sign out. I'll be back.
Yes, Sal, could you give us your comments?
Yeah. So if I'm reading this correctly, Pacella is using AI a decent amount already for documentation purposes. Are you two using it even a little bit in your practices?
I'm using it zero.
Not for clinical stuff, like you said, for fun, not for I listen to Pacella's Chris Cornell versions of all these songs that he sends all the time, like the AI versions of that. That's really about all I use it for.
That was fun.
Pacella, you'll be happy to know that I actually played your entire album in the OR.
Oh, what did people think?
They were all freaked out. So
It's amazing, right?
So yeah, so for our listeners, you want to tell them what you did, Pacella?
Yeah. So first of all, I would love if our listeners went to my YouTube channel. It's actually my YouTube channel and my son's YouTube channel called @GradyArborFilms. Little plug for that. It's got a bunch of videos on there he loves. But what I did was I was sitting around one day and I was, I'm a child of the grunge era. Okay. The music that was around for 5 years and then left. And so I was sitting around and I thought to myself, there's got to be some AI generated Chris Cornell voice. He's the lead singer of Soundgarden. And, his voice is very distinct. He's got a high octave range. And it's a very unique voice. And so I sure enough found this program called Jammable, where you can basically take any clip of any song. You can take any song from YouTube and upload it to any voice you want. Frank Sinatra, Morgan Freeman, anything. And so I found this Chris Cornell AI generator, and I made a 17-song album on this. And it was, I would say that about 60, 70% of the time it was a hit. The other 30, 40% of the time it sounded terrible. But I just kept trial and erroring it. And I uploaded this entire album to YouTube. I hope you can check it out at Grady Arbor Films there. But it's incredible how well it sounds, how close it sounds. It's not perfect, but it's
good.
It's pretty
good. So we listened to it in the operating room, and it upset people. It led to a lot of very philosophical conversations, like, is this real music we're listening to? Because Chris Cornell never even heard these songs. So many of these were songs that came out after he had passed away. So
That's right.
So I'm using it, just so you guys know, I'm using it probably 20 to 25 times a day for my plastic surgery practice. The documentation aspect of my practice has been simplified so much. And as opposed to spending an hour at the end of every day doing notes, I now can do it in real time very quickly. And it's given me an hour of efficiency back. I'm using it extensively for breast surgery, not just augmentation at this point, but mastopexy, breast surgery, breast reductions to simulate what different looks will look like for people. We're using it for rhinoplasty. I think there's a surgical robot used for hair transplant called RTAS that's made by Intuitive Surgical, the same company that makes the Da Vinci. They're incorporating AI into it, and they're at a point now where they're not too far from letting it just harvest hair from people to use. So it's here sooner than, and patients should know that the growth in AI in plastic surgery and in medicine in general is not going to happen in a linear manner. It's just going to explode over the next few years. So be on the lookout.
I'll be ready. I'll be ready to retire and go do something else once I get obsoleted out of my job. I'll be happy with that.
Well, listen, if we're going to close this up, 10 seconds ago, I just asked ChatGPT to, here, I'll let you know what I said here. So write me a poem about 4 plastic surgeons and a microphone and this podcast. And here we go. In the podcast sphere, a unique tone, 4 plastic surgeons and a microphone they own. From California's sun to Toronto's grace, Dr. Sal, Dr. Sam, ×2, and Dr. Tong embrace. With each episode, stories unfold of transformations, both young and old. From Dallas to Jersey, their voices unite, guiding journeys to beauty's light.
That was awesome. And how much information did you give it to write that?
The prompt was, let's see here.
Wow, that's a lot better than what I could write. Let's just
write me a poem about a podcast called 4 Plastic Surgeons and a Microphone. The surgeons are Dr. Sal from California, Dr. Sam from New Jersey, Dr. Sam from Dallas, Dr. Tong from Toronto. That's it.
Impressive.
Wow.
All right. I'm definitely out of a job soon. I can tell with that kind of talent for sure.
And on
The
that
robot
note,
will never replace the meticulous Asians.
This is where Dr. Pacella and I are just going to say nothing other than have a great night, everyone.
Good thing for self-driving cars.
Exactly. And we thank all our listeners as always. Take care, everyone.
All right. Take it easy.